you so much for joining us today.
Thank you for having me here.
Okay, let's start off with, maybe you can introduce yourself a bit, where you're from and what you do.
My name is Boon Lui. I live in Kuching since the last 19 years. Originally, I'm from Johor.
Okay.
Yeah.
Okay, and we can start off with maybe when did you actually find out about that you actually had breast cancer?
It was actually back in year 2006 when I was first encountered, or rather discovered, a breast lump on my left breast. So that particular morning, somehow I sensed it, and immediately I told my husband, and he was the one who actually prompted me to go for checkup as soon as possible. Because just a year before, one of the colleagues actually also had breast cancer and also detected through a breast lump. So that's how the discovery started. And
so your husband had to force you, say, go and see the doctor right away?
He is lucky that he didn't have to force me.
Okay.
I was really obedient.
Okay.
Because I also wanted to find out what actually went wrong with this lump.
Yeah. It's actually quite scary, actually, if you find a lump.
Because I also heard the story about the colleague who went through it. So that morning, or that day itself, I went through some basic ultrasound scan and mammogram.
Okay.
And
so this is in Kuching?
That's happened in Kuching.
Okay.
So it was actually highly suspicious. Something is not right. Some form of malignancy is happening. So a few days later, I was scheduled to do biopsy. So and biopsy took 1 week. At that time, I had some friends who, one of them is actually breast cancer.
1 week? Yeah, 1 week is actually a pretty long time.
Yeah. Actually, 1 week, 7 days sounds like normal for anybody. But for one who is waiting for a result to say whether you are healthy or you have cancer, it's not that easy. It is very, very long. So anyway, during that 1 week, I actually have friends who knew something about breast cancer from my report, highly suspected. He came to talk to me and give me some information, a little bit like counseling, to prepare with some head knowledge.
And after that, how did you start off seeking treatment and things like that for?
Oh, I sent SOS to many friends. One friend particularly, who is actually from Singapore, gave me recommendation to a surgeon in Singapore. And I also have a recommendation from local hospital. So I went through some local counseling, sorry, not counseling, but consultation. And I have some brief description as to what I should go through, like surgery, chemo, radio, and things like that. Okay. So not feeling convinced. So I decided to go to Singapore with my husband to seek second consultation from a doctor there. So
which is important. You need to go and see a few places.
I wanted to find out more, hear more, apart from my own Google search. You know, at that time I always started all the Google search, and it can be very scary. You can have all kinds of information, but not every piece of information is accurate and helpful, but it can be scary. So after the consultation in Singapore, which actually took me 1 hour and 45 minutes, I came out dark already, 8 o'clock, because my surgeon actually gave me a lot of very comprehensive information, everything about breast cancer related to my case, and what treatment and what kind of steps that we can go through step by step, and also to tell me statistically what kind of survival rate I will probably belong to. So that gives me a very good confidence level. So yet, you know, for a woman to go through surgery for breast removal, in my case it has to be a breast removal, I have to think through. I need time. So I went back, I pray, I think, I read some more, then finally I make a conclusion, this is the best thing to do. So I scheduled like 2-3 weeks after, I went to Singapore for the surgery. And also because my family is from my sisters in West Malaysia rather than in Kuching, so I thought it would be good for them to come and help me or care for me when I need to. So I started my treatment as mastectomy, the first step in Singapore. After which I went back to Kuching. I continued all other treatments back there because after all I have young children and they need mommy around, and my husband as well.
So what other treatment? So you first had the mastectomy, and then after that?
A month later, I started off with radiotherapy, 20 sessions. Radiotherapy is local radiation. I have to start with that because at that time I was told from my histological report that so-called the marginal clearance is not good enough, so there may be some remnants of cancer cells in my chest area, so I need to go through that first. After 20 sessions of radiotherapy, Then I went through 8 cycles of chemotherapy.
So I always talk to patients about chemotherapy, going through chemotherapy. How was that? Because it's not a very nice experience for a lot of them. So how was that experience?
Yeah, comparing to radiotherapy is really like a big giant versus a little kid, you know,
Okay.
radiotherapy. So radiotherapy is like a breeze for breast cancer patients. May not be true for other cancers, but for breast cancer, it's totally fine, very little discomfort. So it actually, before I started off with chemotherapy, I was in a stage of so-called in a dilemma to say, do I really want to go for it? Or should I go something else? Or should I go for alternative? Or should I not do anything? Just eat healthy, only veggie and nothing else?
Yeah. There's
So
a lot of questions.
yeah, in fact, I researched on there's a Gerson therapy at that time. It was quite famous in US and some other countries. I even thought of even going all the way out to the US for that, but I thought when I came back 2 weeks or 1 month later, can I still find all the nice food produced with everything 100% organic?
Yeah.
No way. I can't maintain that kind of lifestyle. That's not the way for me.
Yeah.
So I decided, okay, by faith, I go on with chemotherapy. And just read up on the side effects, listen to those who have gone through it, and get advice on diet and so on and so forth. Yeah.
And now talking about treatments for cancer patients, you had the will to say, I want to fight this and I want to do it. But some patients kind of tend to say like, it's not for me, I wouldn't want to do it. So what is your opinion on that? Like, do you think that every patient deserves to say no? Or do you think that every patient needs to fight? Or is it a very personal decision that there is no right or wrong answer for that?
You're right to say there is no right or wrong answer to that. Personally, having been through cancer journey when my children were young, I must tell you that they are like my greatest motivation. And because of them, I want to do my best to preserve my health so that I can be there for them, especially when they are so young. So the available method is chemotherapy, and I have the chemotherapy. I can do it. I don't no financial problem because in GH as well. So why not? Just go for it. Side effects, if other people can overcome, I'm sure I can do that too. I was still young. I was diagnosed at 39 years old. So when it's time for that, it was about 39 to 40 years old. I'm sure I can. So I convinced myself to go for it, even though I was very scared as well, like any other patient.
fear is always going to
I
be
read
there.
up too much actually. So I stopped all the, closed all the websites that is not really helpful, but just read on 1 or 2 books that helped me.